Good evening everyone. Welcome back to our MCQ discussion series. If you missed yesterday's video, don't worry. You can catch up by following the link provided in the description box to watch part 1 video. Now let's dive into today's session with some fresh MCQs. Please feel free to share your answers and queries in the comment section below. Yesterday we have already discussed 17 questions. So we will begin with question number 18 today. Let's start. Please read the question carefully and try to answer it. How many visits should be done by an ASHA worker in a case of hospital-based LSCS delivery? So for hospital-based LSCS delivery, 5 visits should be done by ASHA worker at days 7, 14, 21, 28 and 42. After cesarean section, patient stays at hospital for 7 days. So first 2 visits at day 1 and 3 are not mandatory for ASHA worker. So the right answer is option B, that is 5. The flag sign of hair is characterized by alternating bands of hypopigmented and normal pigmented areas on the hair strand. It is a feature of kwashiorkor, marasmus, Down syndrome, or both A and B. So it is a typical feature of kwashiorkor. Come to the next question. Mr. Ghosh resides in a house with his 2 wives and their dependent children in a rural village. During the puja vacation, his brother Anil and his spouse visited Mr. Ghosh's house from Kolkata. Identify the type of Mr. Ghosh's family. So from the statement given, it's clear that it is an example of nuclear family. Next, the diseases screened under RBSK include all except. So RBSK means Rashtriya Bal Shastro Karyakram. It is a new initiative aiming at early identification and early intervention for children from birth to 18 years of age to cover 4 Ds. What are the 4 Ds? Defects at birth, deficiencies, diseases, developmental delays including disability. So here, which one is the exception? Option A, that is diarrhea. Next, current activities under NLEP include. So NLEP means National Leprosy Eradication Program. So which is the current activities included? ASHAs diagnose leprosy cases at village level. So this is the right answer. Question number 23. If the prevalence is very low as compared to incidence of disease, so the disease is very fatal, the disease is non-fatal, the disease is not treatable. So what is the right answer? Right answer is option A. As here is the prevalence is very low as compared to incidence. So the disease is very fatal or the disease is easily curable. Come to the next question. Which one is an index of communicability of an infection? Secondary attack rate, primary attack rate, prevalence rate, case fatality rate. So which is the index of communicability? That is secondary attack rate. So option A is the correct answer. Osmolarity of reduced osmolarity ORS is 270, 245, 290 or 311. See the picture. Osmolarity of the low osmolarity ORS is 245, but the standard ORS has the osmolarity of 311. So here the right answer is 245, that is option B. Epidemic dropsy is caused by a toxin, sanguinarine, BOA, that is beta oxalyl amino alanine, aflatoxin, or pyrrolizidine. So what is the right answer? Epidemic dropsy is caused by sanguinarine. Denominator for calculating proportional mortality rate for a specific disease. So what is the right answer? To calculate proportional mortality rate, denominator will be total deaths in that year. Screening of a disease is recommended in which of the following conditions? Low case fatality, diagnostic tool not available, no effective treatment is available, early diagnosis can change disease course because of effective treatment. So what are the criteria of screening? The condition should be an important health problem. The natural history of the condition should be understood. There should be a recognizable latent or early symptomatic stage. There should be a test that is easy to perform and interpret, acceptable, accurate, reliable, sensitive, and specific. There should be an accepted treatment recognized for the disease. Treatment should be more effective if started early. There should be a policy on who should be treated. Diagnosis and treatment should be cost effective, or case finding should be a continuous process. So these are the criteria of screening test. So what is the right answer? Early diagnosis can change disease course because of effective treatment. Come to the next question. All of the following statements are true except wasting indicates acute malnutrition, that is true. Stunting is an indicator of linear growth retardation, that is also true. Underweight is often used as a basic indicator of status of population's health, that is also true. Severe malnutrition is defined by low weight for height or length, z-score below -2 SD. So this is the wrong statement. Option D is the wrong statement, because z-score should be below -3 standard deviation. The major intervention strategies required for the prevention and management of anemia under Anemia Mukt Bharat focus on the following except prophylactic IFA supplementation and periodic deworming for all at risk groups, intensified behavior change communication to improve IORCF, increase in intake of iron rich food, ensuring delayed cord clamping after delivery by 3 minutes in health facilities, screening all children, adolescents, and women of reproductive age group to detect anemia. Last option is the incorrect one. This is 6 into 6 into 6 strategy, because there are 6 beneficiaries only. All the age groups are not included here. Next question. Temporal association of a disease is best established by case control study, cohort study, cross-sectional study, experimental study. Temporal association in epidemiology refers to relationship between an exposure and an outcome over time. So temporal association of a disease is best established by cohort study. All are the inherent properties of a screening test except. So what do you mean by inherent property? Inherent property refers to characteristics or quality that is an essential and natural part of something, meaning it is inherently present and inseparable from that thing. In the context of screening test, inherent properties are fundamental traits or attributes that are integral to how the test functions and performs in identifying a particular condition or disease. Sensitivity, specificity, predictive accuracy, these are all the inherent properties of screening test, but validity is not the inherent property. Validity means accuracy. Next question. Needle used after vaccination is disposed in which of the following color coded bags? Sharp should be discarded in white, translucent, puncture proof, leak proof, or tamper proof container. So right answer is option D, that is white. Brugia malayi is transmitted by which mosquito? This is a straightforward question. So answer is Mansonia. Cutaneous leishmaniasis is caused by all except Leishmania donovani, Leishmania tropica, Leishmania brasiliensis, or Leishmania major. Leishmania donovani causes visceral leishmaniasis. So the right answer is Leishmania donovani. Leishmania tropica, brasiliensis, and major cause cutaneous leishmaniasis. Safe and wholesome water does not include free from pathogenic agent, free from harmful chemicals, free from color and odor, free from chlorine. So what is the wrong statement? Free from chlorine. So option D is the correct answer. Municipal waste should be collected in which color coded bag? So municipal waste should be collected in black bag. Measures of central tendency are all except mean, median, mode, standard deviation. So what is the right answer? Standard deviation. It is the measures of dispersion. Kata thermometer is now used to measure. Here the keyword is now. Kata thermometer is now used to measure. Kata thermometer was originally devised to measure the cooling power of the air, but it is now largely used as an anemometer for recording low air velocities rather than cooling power of the air. So right answer is air velocity. So option C is the correct answer. Disaster management cycle is represented by. Please read the question carefully and try to answer it. First option is preparedness, disaster impact, response, rehabilitation, reconstruction, mitigation. Please see the cycle. See the previous image also. This is the Kata thermometer and this is the globe thermometer and this is the disaster cycle. Disaster impact, response, rehabilitation, reconstruction, then mitigation, then preparedness, then again disaster impact. So this is the complete cycle. What is the desired couple protection rate to achieve demographic goal of NRR equal to 1? That is net reproduction ratio will be 1. So desired couple protection rate should be more than 60%. So option B is the correct answer. The denominator of maternal mortality rate is expressed as, here the keyword is maternal mortality rate, not the ratio. So what will be the denominator? Denominator will be women of reproductive age, but in case of ratio the denominator will be live births. Next question. The cutoff level of hemoglobin for diagnosis of anemia in an adult pregnant woman. 11 gram per dl, 11.5 gram per dl, 12 gram per dl or 12.5 gram per dl. So WHO defines anemia in children aged under 5 years and pregnant women as a hemoglobin concentration below 11 gram per dl at sea level, and anemia in non-pregnant women as a hemoglobin concentration below 12 gram per dl. So here in case of pregnancy, the cutoff will be 11 gram per dl. So option A is the right answer. Headquarters of UNICEF is at Headquarters of UNICEF is at New York. Bagasosis is caused by cane fiber, cotton dust, or hay fiber, beryllium. So bagasosis is caused by cane fiber or sugar cane dust. Niti Aayog replaces Health Commission, Finance Commission, Planning Commission, Nutritional Commission. So what is the right answer? Niti Aayog replaces Planning Commission. So option C is the right answer. ICDS comes under the Ministry of Women and Child Development. All are autosomal dominant traits except retinoblastoma, neurofibromatosis, polycystic kidney disease, cystic fibrosis. So right answer is cystic fibrosis. Cystic fibrosis is autosomal recessive. Juvenile delinquency is applicable for a girl child aged less than. What will be the right answer? Actually, for the girl child, it is 18 years, but here the best choice will be 17 years as per the choices given in the question. Juvenile means a boy who has not attained the age of 16 years or a girl who has not attained the age of 18 years. When a child repeatedly commits a crime, he or she is known as juvenile delinquent. So here the right answer for the girl child will be 17 years, but actually it is 18 years. What is the ideal body weight for an Indian reference man? 50 kg, 60 kg, 65 kg, 70 kg. So what is the right answer? For Indian reference man, body weight will be 65 kg, and for Indian reference woman, weight will be 55 kg. Age will be 19 to 39 years for both. Height will be 177 centimeter for male and 162 centimeter for female. Weight will be 65 kg for male and 55 kg for female, and BMI will be 20.7 kg per meter square for male and 20.95 for female. ICDS does not cover nutritional supplementation, formal education, health education, immunization. See the picture again. So ICDS include supplementary nutrition, immunization, preschool education or non-formal education, health checkup, health and nutritional education, referral services. Right answer will be formal education. Actually, it is non-formal education. ICDS include non-formal education, but here option is formal education. So right answer will be formal education. All of the following are the sites of measuring skin fold thickness except options are mid triceps, biceps, suprascapular or suprailiac. Skin fold thickness measurements are done at 4 sites, namely triceps, biceps, subscapular and suprailiac using Harpenden skin fold caliper. So what will be the answer? Suprascapular. Actually it would be subscapular. So option is given here is suprascapular. So Option C is the right answer. In the calculation of general fertility rate or GFR, the denominator is women in the reproductive age group 15 to 44 years. That is option A. Black stay kit by NACO is used for urogenital infection, genital ulcer, scrotal swelling, inguinal bubo. So what is the right answer? Black stay kit is used for inguinal bubo. This is the black stay kit. Is the kit number 7. Next, vitamin A prophylaxis to children is an example of primordial prevention, primary prevention, secondary prevention, or tertiary prevention. So what is the right answer? Vitamin A prophylaxis is primary prevention because it is specific protection. Health promotion and specific protection are the modes of intervention of primary prevention. Minamata disease and Itai disease are caused by dash. So Minamata disease is caused by mercury and Itai disease is caused by cadmium. So option A is the correct answer. In screening for a disease, if the cutoff level is lowered, then what will be the change? Sensitivity will increase, specificity will increase, positive predictive value will increase, there will be no change. So what is the right answer? In screening test, if cutoff is lowered, then false negative will be decreased. So when false negative is decreased, then sensitivity will be increased automatically because sensitivity is equal to true positive by true positive plus false negative. So in denominator, false negative is decreased, so sensitivity will be increased. OCP protects against all except breast cancer, iron deficiency anemia, pelvic inflammatory disease, ovarian cyst. So what is the right answer? OCP protects against all except breast cancer. Anti-tubercular drug which causes optic neuritis is ethambutol, rifampicin, isoniazid, pyrazinamide. Isoniazid causes skin rash, hepatitis. Rifampicin causes abdominal pain, nausea, vomiting, hepatitis, thrombocytopenic purpura. Pyrazinamide causes arthralgia, hepatitis. Ethambutol causes retrobulbar neuritis or ocular side effects. Which anti-tubercular drug causes optic neuritis? Right answer is ethambutol. The clinical goal for prevention of coronary heart disease, the cholesterol HDL ratio should be less than 3.5. This is the right answer. A lady who was 28 weeks pregnant unfortunately died in an RTA. While calculating MMR, she will be included in the numerator, included in the denominator, included in both, or will not be included in either. So what is the right answer? In calculation of MMR, RTA will not be included because only pregnancy related causes are included in calculation. Next, copper T380A should be replaced once in 4 years, 6 years, 8 years, 10 years. So right option is option D, that is 10 years. Epidemic curve is used to describe distribution according to person related variables, distribution according to place related variable, distribution according to time related variable, or none of these. This is the epidemic curve. So this is time related variable. So option C is the right answer. Next, predictive value of screening test depends on prevalence, sensitivity, specificity, or none of these. So predictive value depends upon prevalence, although it depends on sensitivity, specificity also, but the best option is prevalence. Which of the following is not a measure of dispersion? What are the options? Quartile, percentile, standard deviation, mode. So here mode is not the measures of dispersion because it is measures of central tendency. So right option is mode. You all know that mode is the most frequently occurring value. Next, both night soil and solid waste could be disposed together by sanitary landfill, manure pit, composting, controlled tipping. So what is the right answer? Both night soil and solid waste could be disposed together by composting. Next, the incidence of morbidity and mortality due to pertussis is higher in males, higher in females, equal in both sexes, higher in males than females in different countries. So what is the right answer? Incidence of morbidity and mortality due to pertussis is higher in females. Commonest opportunistic infection in patients with HIV is, what is the right answer? Right answer will be Pneumocystis carinii pneumonia. Which of the following serves as a natural host for Ebola virus? So what is the right answer? Human, birds, fruit bats, pigs. So right answer is fruit bats. The mean energy requirement per person per day that has to be catered for by provision of appropriate food at times of disaster is, what is the right answer? During disaster, energy requirement will be 2100 kilocalorie. So right option is option C. Next, which type of workers in cotton industries are commonly affected in bicyanosis? Growers, spinners, weavers, dyers. So who are most vulnerable? Spinners. Spinners are commonly affected in bicyanosis in cotton industry. The term nutri-cereals is applicable to wheat, bajra, rice, maize. So most of millet crops are native of India and are popularly known as nutri-cereals, as they provide most of the nutrients required for normal functioning of human body. So here right answer will be bajra. Jowar, bajra, ragi, these are millets. Next, to improve iron intake or absorption, include vitamin C rich food, take IFA supplement, minimize coffee tea during meal time, or all of these. So right answer will be all of these. District Early Intervention Center or DEIC is a part of Emergency Obstetric Care, Essential Obstetric Care, RBSK, Navjat Shishu Suraksha Karjakram. So what is the right answer? It is a part of RBSK, that is Rashtriyo Bal Shastho Karjakram. ICDS is run by Ministry of Health, Ministry of Home, Ministry of Human Resource Development, or none of these. So here right option will be none of these, because it is run by Ministry of Women and Child Development. The active agent in spermicidal jelly is 9-xylenolol, 9-xylene, 9-nonoxynol, or 9-nonoxylenol. So option C is the right answer. Spermicidal jelly contains 9-nonoxynol. Which of the following is not a contraindication for OCP use? Hyperlipidemia, unexplained vaginal bleeding, liver cirrhosis, anemia. So right option is anemia. Anemia is the indication of OCP use, not contraindication. Clinical history taking from patients is an example of structured interview, unstructured interview, counseling, health education. So what is the right answer? Right answer is structured interview. Because clinical history taking from patients typically follows a structured approach where healthcare professionals ask specific questions or a pre-planned set of questions to gather relevant information about the patient's medical history, symptoms, and other pertinent details. So option A is the right answer. The mental habits acquired from social experiences that predispose people to react to specify situations in a specific manner are known as attitude. Analysis which measures both inputs and outputs in terms of money for making comparison between two different strategies is called input-output analysis. The measure of frequency in which the numerator is not a part of denominator. In ratio, numerator is not a part of denominator. Another name of randomization is random sampling, random allocation, random error, random variable. So what is the right answer? Option B is the right answer. Randomization means random allocation. For establishing a cause and effect relationship, we need to undertake case control study, cohort study, experimental study, or all of these. Right answer will be all of these, because in case control study or in cohort study or in experimental study, cause and effect relationship is established. Predictive value of a screening test depends on. Similar question has been discussed previously. Predictive value of a screening test depends on prevalence, sensitivity, health worker, none of these. So what is the right answer? Predictive value always depends on prevalence. Kata thermometer measures low air velocity, radiant heat, atmospheric humidity, temperature. So what is the right answer? This question has also been discussed previously. Kata thermometer nowadays is used to measure low air velocity and also cooling power of air. Bivalent OPV does not contain poliovirus serotype 1, poliovirus serotype 2, poliovirus serotype 3, live attenuated poliovirus. So bivalent OPV does not contain poliovirus serotype 2. All are micronutrients except iron, iodine, zinc, calcium. So calcium is not a micronutrient, it is a macronutrient, because RDO of calcium for adult male or female 1 gram or 1000 milligram per day, and in case of lactation or in case of post menopausal women, 1.2 gram per day or 1200 milligram per day calcium is needed. Important HIV antigen for early determination of HIV infection is P24, GP120, Pol gene or GP120. So what is the right answer? P24 is the right answer. This is used for early determination of HIV. All of the following are mode of transmission of leprosy except droplet transmission, contact transmission, tattooing, vertical transmission. So droplet transmission, contact transmission, tattooing, as well as from some insect bite, leprosy can be transmitted, but vertical transmission is not the mode of transmission of leprosy. So right option is option D. Which of the following is not Social Security legislation? Factories Act, ESI Act, Maternity Benefit Act, Employees Provident Fund Act. So what is the right answer? Factories Act, because this Factories Act primarily deals with the regulation of factories and labor conditions, focusing on issues such as working hours, health, safety and welfare of workers. Available chlorine in freshly prepared bleaching powder is 40%, 30%, 33%, 36%. So the right option is 33%. National Family Health Survey is done in every 6 months, 1 year, 5 year, 10 year. So what is the right answer? National Family Health Survey is done in every 5 years. Upper reference curve in WHO growth chart is, this is the WHO growth chart, and upper reference curve is 97th percentile and lowest reference curve is 3rd percentile. So what is the right option? Option D. For effective group discussion, the group should comprise of the following number of members: 2 to 4, 6 to 12, 15 to 20, 25 to 30. So what is the right answer? It is 6 to 12 or below 15 for group discussion. So the right option is option B. The OCPs protect against all except fibroadenoma of breast, iron deficiency anemia, ovarian cancer, hepatocellular adenoma. So OCP protects against all, as like fibroadenoma of breast, iron deficiency anemia, ovarian cancer, but OCP does not protect against hepatocellular adenoma. Population growth is rated to be explosive if the annual growth rate exceeds 2%. So the right answer is option D. Population doubling time is calculated by a formula, that is 70 by growth rate. So if growth rate is 2%, then doubling time will be 70 by 2, that is 35 years. Which of the following is not a part of RMNCA's plus N program? RMNCA's plus N strategy covers reproductive, maternal, newborn, child and adolescent health, and the plus within it focuses on nutrition. So what is the right option? Maternal health, nutrition, adolescent health, these are included, but geriatric health is not included in this program. So option C is the right answer. Expired drugs, animal anatomical waste or placenta, soaked cotton, etc. should be discarded in yellow bag, red bag, blue box, white container. So These all are discarded in yellow bag. Periodical cash payment to a sick insured person under the ESI Act is known as sickness benefit, medical benefit, disablement benefit, unemployment benefit. So what is the right answer? Right answer is sickness benefit. Under the ESI Act, the sickness benefit is typically provided at the rate of 70% of the wages and is payable for a maximum of 91 days in a year. And extended sickness benefit is given for 34 diseases for the period of 2 years. Validity of screening test means accuracy, repeatability, acceptability, yield. What is the right answer? Validity means accuracy. National Institute for Occupational Health is situated in Chennai, Bhopal, Ahmedabad, Bengaluru. What is the right answer? National Institute for Occupational Health is situated in Ahmedabad in Gujarat. Open vial policy allows reuse of the following vaccines except pentavalent hepatitis B, BCG, rotavirus. Right answer is BCG. In case of pentavalent hepatitis B and rotavirus, open vial policy is applicable. Occupational disease which increases the risk of tuberculosis is asbestosis, anthracosis, silicosis, biocinosis. So, which occupational disease increases the risk of tuberculosis? That is silicosis. Contraceptive which is not under National Family Planning Program. Antara, Easy Pill, Chaya or Mala D. Easy Pill means emergency contraceptive pills, that is levonorgestrel containing pill. So what is the right answer? Mala D. Actually Mala N is included in the National Family Planning Program. Adult OPV vaccination certificate remains valid for the period of 1 year, 2 years, 5 years, lifelong. Right answer is 1 year. Role of vitamin B9 in IFA tablet is to treat neural tube defect, prevent megaloblastic anemia, correct neurological symptoms, or both A and B. So what is the right answer? Right answer is prevent megaloblastic anemia, because neural tube defects occur in first trimester, but IFA tablet is given in the second trimester, that is after 12 weeks of gestation. The government of India announced a mission to eliminate sickle cell anemia by 2025, 2030, 2047 or 2050. This is a straightforward question. So right answer is 2047, that is 2047. Example of water washed disease is trachoma, malaria, schistosomiasis, dracunculosis. So what is the right answer? Water washed disease is trachoma. Other water washed diseases are conjunctivitis, scabies, etc. Salt restricted diet was advised to an myocardial infarction patient during discharge. It is an example of primordial prevention, primary prevention, secondary prevention, tertiary prevention. So right answer is tertiary prevention, because already disease has progressed, so further disabilities should be decreased. This is disability limitation. A 16-week pregnant woman came to you after 5 days of exposure to a chickenpox patient. Which of the following would be given to her? Varicella vaccine, Varizig, acyclovir, both B and C. Actually, Varizig is recommended to be administered as soon as possible following exposure, ideally within 96 hours. However, the Centers for Disease Control and Prevention or CDC recommends that it can be administered as late as 10 days after exposure. Here the best choice will be acyclovir because the lady came to you after 5 days of exposure. So best option is acyclovir. If cutoff is increased for an screening test, then false positive will be increased, false negative will be increased, sensitivity will be increased, specificity will be decreased. So what is the right answer? Similar question has been discussed previously. So if cutoff is increased, then false positive will be decreased and false negative will be increased. So right option is option B. Vitamin A deficiency of a severe acute malnutrition child or SAM child is treated with initial 3 doses at day 1, 2 and 14, initial 3 doses and monthly thereafter, initial 3 doses and at 6 months, or vitamin A is contraindicated. So the right option is option B, that is initial 3 doses and monthly thereafter. For TB preventive therapy, isoniazid daily for 6 months or isoniazid plus rifampicin weekly for 3 months is given. So here what is the right answer? Option B, 3-HP or isoniazid plus rifampicin weekly for 3 months is given. So option B is the right answer. In a skewed distribution, mean, median and mode are 18, 15 and 12 respectively. It is an example of positive skewness, negative skewness, no skewness or cannot be determined. So what is the right answer? It is positive skewness because mean is greater than median and median is greater than mode. So it is an example of positive skewness or right skewness. Objective of Poshan Abhiyan is to reduce prevalence of anemia in children at least 3% per year. So option C is the right answer. Kayakalp award is given to hospital administration if hospital is 50% sanitized, 70% sanitized, 90% sanitized or 100% sanitized. So what is the right answer? Right answer is 100% sanitized. Vasectomy fortnight is organized from. What is the right answer? November last week to December first week. So right answer is option B. Attitude is not affected by. What are the options? Knowledge, emotion, motivation, prior experience. So attitude is not affected by motivation. Maximum possible value of correlation coefficient. -1 to +1, 0 to +1, -1 to 0 or +1 to +2. So the right answer is -1 to +1. See the picture. For perfect positive correlation, the value is 1, that is +1, and for perfect negative correlation, the value is -1. False statement about RBSK. Launched in February 2013, age group 0 to 18 years, cover 20 identified health conditions, early detection and management of 4Ds. The similar question has been discussed previously, so answer the question. This program involves screening of children from birth to 18 years of age for 4Ds. These are defects at birth, diseases, deficiencies and developmental delays spanning 32 common health conditions for early detection and pre-treatment and management, including surgeries at tertiary level. So option C is the wrong statement because it covers 32 common health conditions. Here the option is wrong. It is given as 20. Next, not true about UCAC for metro cities? 150 to 200 beds, 100 beds established for 5 lakhs population, 1 CAC for 5 to 6 UPACs. False statement is 150 to 200 beds. Next, all are included in deadly dozen wildlife diseases in the age of climate change except sleeping sickness, dengue, yellow fever, cholera. 12 diseases are included in the deadly dozen list as like avian influenza, babesiosis, cholera, Ebola, intestinal and external parasites, Lyme disease, plague, red tides, Rift Valley fever, sleeping sickness, tuberculosis and yellow fever. So what is the wrong statement? Option B, that is dengue. Dengue is not included in it. Who played an important role for Great Sanitary Awakening, which led to the enactment of the Public Health Act 1848 in England? Edwin Chadwick, John Snow, Leeuwenhoek, John Simon. So right option is Edwin Chadwick. Total number of FIPV doses under the latest NIS in India is 1, 2, 3, 4. This is very important and it is recent update. Nowadays 3 doses of FIPV is given since January 2023. At 6 and 14 weeks, the vaccine is given at right upper arm, and at 9 months of age, the vaccine is given at left upper arm. Since MR vaccine is already being given at right upper arm, it is given intradermally. Globe thermometer is used for measuring air temperature, radiant temperature, cooling power of air, relative humidity. Air temperature is measured by electronic thermometer. Cooling power of air is measured by Kata thermometer. Relative humidity is measured by hygrometer. So here right answer is radiant temperature, that is option B. Attributable risk in a cohort study means strength of association, temporal relation, causal relation, potential for prevention. HbA1c reflects the mean blood glucose level of previous 15 days, 1 month, 3 months, 6 months. What is the right answer? This is 3 months. Option C is the correct answer. Histogram is used to present which type of data? Histogram is used to present continuous data. So option A is the correct answer. The number of abortions performed divided by the number of live births in the same period is known as abortion rate, abortion incidence, abortion prevalence, abortion ratio. Remember, when we use live birth in the denominator, it is ratio, as like MMR means maternal mortality ratio. So here is also live birth in the denominator, so it will be abortion ratio. A patient on anti-tuberculosis therapy should be advised to take the supplement of niacin, pyridoxine, pantothenic acid, thiamine. What is the right answer? Right answer is pyridoxine, because pyridoxine supplementation helps mitigate the neurological side effects, that is peripheral neuropathy caused by isoniazid. What type of epidemic curve is this? Point shows single exposure, point shows multiple exposure, propagated, a cyclical trend. So this is the picture of propagated epidemic. Propagated epidemic spreads gradually from person to person over time rather than all at once. Example, epidemics of hepatitis A and polio. Next, a ratio between incidence of disease among exposed and non-exposed is called risk ratio, odds ratio, incidence ratio, attributable risk. So the right answer is risk ratio. Risk ratio means relative risk. Reverse cold chain is maintained in expired vaccine from PHC to manufacturer, carrying vaccine to peripheral center, stool specimen of polio is sent for testing, all of this. So what is the right answer? Stool specimen of polio is sent to testing. Stool specimen of polio is sent to laboratories for testing because stool samples are sent to laboratory from the field at certain temperature. But in case of cold chain, it is from manufacturer to the periphery. But in this case, that means in reverse cold chain, this is periphery to lab. So this is called reverse cold chain. A 42 days old infant has severe pneumonia. Her respiratory rate per minute will be more than 30, more than 40, more than 50, more than 60. We all know that below 2 months of age, the cutoff of respiratory rate to classify it as fast breathing is more than 60. So right option is option D, because the child is below 2 months of age. In biomedical waste management, all of the following items should be discarded in yellow bag except used urine bag, culture media, expired medicine, blood soaked gauze. So urine bag is the answer of this question, because urine bag should be discarded in red bag because it is reusable. But culture media, expired medicine and blood soaked gauze should be discarded in yellow bag. Matching is done for removal of bias, known confounders, unknown confounders, or both B and C. So right answer is matching is done for removal of known confounders, and randomization is done to eliminate known and unknown confounders. Critical path in network analysis is the path which is most expensive, least expensive, longest or shortest. See the picture. Critical path is the longest path. So in this picture there are two critical paths. One is B and C, that is 4 plus 3, 7 months, and another is A, D and F. A, D and F, that is 3 plus 1 plus 3, that is also 7 months. So there are two critical paths in this picture. The critical path is the longest path through the network, and time along this path gives the project duration. Condom vending machine at petrol pumps in areas with high prevalence of HIV or AIDS is an example of social marketing, community participation, high risk strategy, appropriate technology. So this is an example of social marketing. Retrospective evaluation of medical performance is known as medical evaluation, performance evaluation, medical audit, or none of this. Retrospective evaluation of medical performance is known as medical audit. Planning cycle has several steps, like see the steps and arrange it sequentially. First is analysis of health situation, then objectives and goals fixation, then assessment of resources, then priorities, formulate plan, programming and implementation, then monitoring, then evaluation, then again analysis of health situation. Option B will be the correct answer. Question number 141. Interval between entry of pathogen and appearance of first symptom is known as. It is known as incubation period. So option B is the correct answer. Vaccine or vaccines must be stored in freezer compartment of the refrigerator. OPV, pentavalent, measles, or both A and C. So both A and C, that means OPV and measles would be stored in freezer compartment. Following are the measures of disease frequency except incidence rate, prevalence, cumulative incidence, relative risk. What is the right answer? Incidence rate, prevalence and cumulative incidence are the measures of disease frequency. So here the answer will be relative risk, option D. False statement about dengue fever is. Breakbone fever is characteristics. Tunicate test is positive. Serotype 4 is most dangerous. Aedes aegypti is the main vector. What is the right answer? Serotype 4 is most dangerous. It is the wrong statement because serotype 2 is most dangerous. So option C is the right answer. What type of population must be preferred to increase yield in a screening program of a disease? High risk population, general population, migrant population, population suffering from a specific disease. The right answer will be high risk population, that is option A. Open vial policy is not applicable for MR vaccine and BCG vaccine. So option B is the correct answer. In a survey, the number of children per family were 4, 6, 2, 2, 4, 3, 2, 1 and 7. Mean, median and mode are respectively. So it is a calculative question. Mode is the most frequently occurring value. Here most frequently occurring value is 2. So mode is 2 and mean is 3.4 after calculation and median will be 3. So option D is the correct answer. Disease causation is best explained by theory of one-to-one relationship between causal agent and disease, supernatural theory of disease, empirical theory of disease causation, multifactorial theory of disease causation. So option D is the correct answer. Question number 149. The term disease control employs all of the following except reducing the complication, reducing the risk of further transmission, reducing the incidence of disease, reducing the prevalence of disease. Right answer will be reducing the prevalence of disease. Disease control means reducing the complication, reducing the risk of further transmission and reducing the incidence of the disease. Disease control does not mean reducing the prevalence of disease. In disease elimination, disease agent is permitted to persist in the community at a level where it ceases to be a public health problem according to the tolerance of the local population. Elimination means interruption of transmission of disease. Example, elimination of measles, polio and diphtheria from large geographical regions. Eradication means termination of all transmission of infection by extermination of the infectious agent. Example, smallpox. In relation to case control study, which of the following is not correct? Many etiological or risk factors can be studied at the same time. Yes. Proceeds from effect to cause. It is also true. Sequence of events is not known. Several possible outcomes can be studied. So here the right answer will be option C. Sequence of events is not known. But in case control study, sequence of events is known. Ideal retention period in septic tank is 12 hours, 24 hours, 36 hours, 48 hours. So right answer is 24 hours. Bicyanosis is a pneumoconiosis caused by inhalation of sugarcane dust, cotton, coal particles, asbestos. Option B is the right answer. Vitamin A prophylaxis as per NIS to a child is an example of primordial prevention, health promotion, specific protection, secondary prevention. So it is an example of specific protection. Applying chi-square test to a contingency table of 3 rows and 3 columns, the degree of freedom would be on 4, 9, 8. So the formula to calculate degree of freedom is number of rows minus 1 into number of columns minus 1. So here 3 minus 1 into 3 minus 1. So 2 into 2 equal to 4. So option B is the correct answer. Quality antenatal checkup under PMSMA scheme is offered on 9th day of each month. Which one is not a correct component of AFASS guidelines for infant feeding? AFASS denotes acceptable, feasible, affordable, sustainable and safe. So accessible is not included in AFASS. So option C is the correct answer. Which agency monitors air quality in India? Central Research Institute, Ministry of Health and Family Welfare, Central Pollution Control Board or CPCB, or National Environmental Engineering Research Institute. So here CPCB or Central Pollution Control Board is the right answer. Sharps or needles and vials should be discarded in. This question has also been discussed previously. Sharps should be discarded in white bin and vials or glasswares should be discarded in blue box. Herd immunity is 0 in tuberculosis, leprosy, measles, tetanus. So herd immunity is 0 in tetanus. In an outbreak of cholera in a village of 2000 population, 20 cases had occurred and 5 died of cholera. Calculate CFR. CFR means case fatality rate. So total number of cases 20 and 5 died of cholera. So 5 by 20 into 100. So the answer is 25%. The association between smoking and lung cancer can be studied by obtaining smoking histories of lung cancer patients at the time of their visit and then subsequently correlating smoking histories from persons who don't have lung cancers. What type of study is this? So this is case control study. So option A is the correct answer. Positive predictive value is most affected by. Positive predictive value is most affected by prevalence. This question has also been discussed previously. ORS once prepared should be used within 6 hours, 12 hours, 24 hours, 48 hours. So right answer is 24 hours. The term night blood smear is specific for malaria, filariasis, leprosy, onchocerciasis. Right answer is filariasis. Microfilaria can be detected microscopically on blood smears obtained at night between 10 p.m. to 2 a.m. and a thick smear should be made and stained with GMSA or hematoxylin and eosin. In a standard normal curve, mean plus minus 2 standard deviation covers approximately 95%, and mean plus minus 1 standard deviation covers around 68%, and mean plus minus 3 standard deviation covers about 99%. Type of biological transmission of malarial parasite in Anopheles mosquito is developmental, cyclodevelopmental, propagative or cyclopropagative. So malarial parasite in Anopheles mosquito, this is an example of cyclopropagative transmission.